Thank you everyone for joining us. I'll just begin by acknowledging that we are all meeting, well, virtually on Aboriginal land today, and we pay our respects to Aboriginal and Torres Strait Islander people, acknowledging elders past, present and emerging, and extend this respect to any Aboriginal colleagues joining us today. We acknowledge that sovereignty was never ceded and that this was always and will always be Aboriginal land. So officially, good morning everyone. I'm Carolyn Davies. I use she, her pronouns. Thank you for joining us for another AVITH in Context webinar. The Centre has been interested in working on this topic of adolescent violence in the home since our first project that we began back in 2019. We now deliver free events and resources such as this webinar today. We also facilitate the community of practice for the specialist adolescent violence programs throughout Victoria. And we're now looking at delivering customised training on the topic of adolescent violence in the home. So we'll try and put a few links to those resources in the chat a bit later. Our webinar guests today are Dr. Kate Fitz-Gibbon and Dr. Silke Meyer from Monash's Gender and Family Violence Prevention Centre. Kate and Silke will be presenting findings from the ANRO's funded research project, which draws directly on the voices of young people themselves and has culminated in 2 reports. The first presenting a national prevalence study on young people's use of violence in the home, including the types and the patterns of violence. And the second report focuses on young people's experiences of accessing supports, including what it's like for them disclosing their use of violence. We will have time a bit later today for audience Q&A. So if you have any questions for Kate or Silke, you can use the Q&A box to ask a question. I think that's everything. So Kate and Silke, if you'd like to kick us off, that would be great.
Thanks for the opportunity for us to present our annual study findings. My name's Silke Meyer, and I would also like to start by acknowledging the traditional custodians of the various lands from which we're all zooming in today. For me, that's the Yagara and the Turrbal people of both sides of the Meanjin River in Brisbane. And pay my respects to elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people zooming in today. Here we go. Okay, so apologies just to confuse everyone. Kate and I were both together at the Monash Gender and Family Violence Prevention Centre when we started this study. Now I am Brisbane-based and at Griffith University, but still affiliated with the centre. So the ANROL study, it was funded by ANROLs in the 2021-2022 funding round that focused specifically on children and young people's experiences of and or use of domestic and family violence. And as Carolyn has said, draws directly on the voices of young people. And we had a fabulous research team. So Kate, who will be doing the second part of the presentation, led the study. And we also had Professor Jane Marie Meyer, Professor Stephen Roberts from Monash, and Dr. Haley Boxall from the AIC, who worked with us on this project. The broader study captured nature and prevalence of adolescent use of violence in the home, including the overlap with other forms of domestic and family violence, including child maltreatment, experiences of direct abuse and neglect, as well as growing up with other people's use of violence in the home, including carer and parental domestic and family violence. We looked at impacts of experiences as well as use of violence in the home, experiences of disclosure and help seeking, and the support needs that arise from that. So for the first part of the presentation, I'll focus on just a bit of an overview of the patterns of use and experiences of violence among young young people in this study, before I hand over to Kate, who's going to talk more about the disclosure experiences and support needs that arise from young people's self-reported use and experiences of violence in the home. So we had just over 5,000 young people participate. We used an open research unit research panel to recruit this sample size. And while it was, like I guess a fabulous sample in terms of getting the sample size, it is not fully representative of the population of young people in Australia, particularly when it comes to regional representation, remote regional. We don't have the representation of the national young people population in the sample. We did have a significant amount of Aboriginal and Torres Strait Islander young people, and we'll be touching on some of those findings, but again, keeping in mind that I think particularly for the Aboriginal and Torres Strait Islander young people, the demographic dispersity in Australia isn't necessarily representative of the demographic, of the geographic locations where young people participated in the survey from. In terms of experiences and use of violence, we captured a range of different types of violence, very similar to what we see in our other national surveys, including the Personal Safety Survey, for example. So for experiencing other people's use of violence in the home, we've labeled this as witnessing, just for the purpose of data analysis and separating out growing up with domestic and family violence between other family members, as opposed to direct forms of child abuse and neglect. But obviously recognizing that witnessing domestic and family violence essentially means experiencing domestic and family violence during childhood. And then we also captured the same kind of types of violence for young people's self-reported use of violence in the home, and the types of violence included verbal, emotional, and physical abuse, sexual abuse, strangulation, property damage, threats of harm directed at the survey participants, threats to harm other people close to the survey participant, and also identity-based abuse. And in terms of who was involved in young people's use of violence, as well as their experiences of violence, as much as we don't go into too much detail in today's presentation, that level of detail is covered in the report. We did look at who's most likely to be at the receiving end of young people's use of violence, who's most likely to be involved in experiences of domestic and family violence and child abuse, and so forth. In terms of the sample characteristics, so we had about 2/3 of the survey participants identified as female assigned at birth, and 1/3 as male assigned at birth. Of the total sample, we had 4% of young people that were gender diverse or gender questioning. And we had almost 1/3 of young people identifying as diverse sexual orientation, so anything other than heterosexual orientation. And I will be touching on some of those priority cohorts throughout the presentation. We had 5% of young people in the survey that identified as Aboriginal and or Torres Strait Islander. 10% of young people identified as coming from a non-English speaking background. And just over 1/3 of young people in the survey reported living with at least one disability. Again, there is more detail on disability, and happy to answer any questions. We haven't really broken down the disability prevalence in greater detail, but we've started to look at that if that's of particular interest to anybody. So in terms of young people's use of violence, we had 1 in 5, or around 20%, that reported any use of violence in the home. And when we looked at patterns of use of violence, or frequency in terms of at least monthly use of violence in the home, around 45% of the young people that had said they ever used any use of violence also reported frequent use of violence as a pattern. In terms of the types of violence that young people reported using in the home, they're probably very similar or reflective to what we're used to seeing in other domestic and family violence self-reported experience studies, I guess, in terms of verbal abuse being the most common type of abuse, For young people, that was followed by using physical types of abuse, followed by emotional and psychological types of abuse, and then decreasingly towards the more, I guess, severe end of use of violence, including threats to harm somebody, threats to kill somebody, engaging in non-fatal strangulation or sexual violence, for example. In terms of young people's experiences of violence in the home, we had just over half had reported some experiences of childhood trauma, including experiencing or growing up with domestic and family violence and or direct forms of child abuse and neglect. And I think what's quite interesting in there is the largest proportion had experienced both. So 28% of young people with experiences of childhood trauma reported that they had experienced domestic and family violence between other family members, as well as been the direct target of child abuse and or neglect. Followed by 23% that reported growing up with domestic and family violence between other family members, but no other forms of direct child maltreatment, including abuse and neglect. Whereas only 2% reported having been the direct target of abuse or neglect without also having domestic and family violence present in the home while growing up, which I think is interesting and maybe important to remember in terms of some of the implications Kate will be talking about later, because it does mean that it is quite common for children to grow up in households where there's domestic and family violence present without necessarily being the direct target of child abuse and neglect, and yet still develop quite significant adverse outcomes over time. Whereas the proportion of young people who only experience child abuse and neglect was very small in our sample, suggesting that where there is direct forms of abuse, abuse and neglect directed at children, it is highly likely that there's also domestic and family violence between other family members going on in the home, whereas we can't necessarily draw the same conclusion where we become aware of children growing up in households where there's parental domestic violence, for example, doesn't necessarily mean that there's also direct forms of child abuse happening in the home. And I guess that has implications for risk assessment, early intervention and support mechanisms, both for children as well as parents or carers involved in those scenarios. We looked at, I guess, patterns, understanding patterns of use of violence in the home and how childhood experiences play into that. And I guess unsurprisingly, so you've got in the orange bars, you've got the young person using violence in the home, and that proportion gets increasingly larger with an accumulation of childhood trauma experiences. So the children with no reported childhood trauma in form of direct abuse and or domestic and family violence between other family members were least likely to report use of violence in the home. Young people growing up with other people's use of violence in the home were more likely. Young people being the direct target of abuse were even more likely to report using violence in the home. And then by the time we're looking at young people who experience both domestic and family violence between other family members and being the direct target of abuse in the home, about 1 in 2 reported using violence in the home during adolescence. Similarly, in terms of the frequency of use of violence and also how many family members were at the receiving end, again, with increasing experiences of childhood trauma, unsurprisingly, young people were more likely to use frequent use of violence. So we had an overall prevalence of, in the AVITH sample, so the young people that had reported use of violence in the home, 9 out of 10 also reported childhood experiences of domestic and family violence and or child maltreatment. That percentage is slightly lower for the ones that reported using AVITH irregularly or episodically, but higher for the ones that reported frequent use of violence in the home. Similarly, no experiences of child abuse or domestic and family violence. The proportion was slightly smaller for the ones that only directed their use of abuse towards one family member. Where there were experiences of child abuse, young people were more likely to then also direct their use of abusive behaviours at multiple family members. In terms of frequency and some of the experiences that predicted frequency, so when we looked at what predicted the frequency of use of violence, the combination of having witnessed domestic and family violence between other family members and having been subjected to direct forms of abuse and neglect was the strongest predictor of using violence in the home on a frequent basis. And then, less likely were young people experienced but didn't witness, or witnessed and didn't experience, and then least likely in the episodic child abuse experiences were also least likely to frequently use abusive behaviours in the home. None of that may be surprising. I think what's quite interesting is, so for frequency, the strongest predictor was having had that cumulative experience of childhood trauma, essentially, whereas for severity, and the difference isn't huge in the ones that used severe forms of violence in the home, but witnessing severe forms of violence between other family members seemed to be a stronger predictor for using more severe forms of violence in the home compared to more severe experiences of direct child abuse, or a combination of the two. We also looked at some of the priority cohorts that we had in the survey to get a sense of whether there were any differences in the different different cohorts of young people. So for young people that identified as Aboriginal and Torres Strait Islander young people, they were no more likely to use any violence in the home. They were also no more likely to use severe forms of violence in the home than non-Indigenous young people who participated in the survey. They were more likely to report frequent use of violence in the home. And I guess the other maybe positive observation is they were also no more likely than non-Indigenous participants in the survey to report experiences of childhood trauma, including growing up with domestic and family violence and/or being the direct target of child maltreatment. That looked quite different for some of our other priority cohorts. So young people who identified as living with a disability were more likely to use any violence in the home, more likely to use severe forms of violence in the home, and more likely to use frequent forms of violence in the home. And I think the important thing to note here, which I guess given what we've talked about in terms of the overlap of childhood experiences of abuse and use of violence, and how frequency and severity predicts use of frequency and severity, young people who identified as living with a disability were also significantly more likely to be the target of direct abuse and experience domestic and family violence. So while we had 20% of young people that didn't identify as living with a disability reporting experiences of DV and being the direct target of abuse, that increased to 44% for young people living with a disability. So not only were they more likely to use violence, but they were also substantially more likely to already have been affected by childhood trauma in form of family violence and child maltreatment. In terms of gender diversity, and noting that cohort was small, where we only had 4% of young people in the total sample that identified as gender diverse or gender questioning. But the cisgender young people were less likely, or the gender diverse young people were more likely to report any use of violence in the home, frequent and severe use of violence in the home. but were also, as you can see on the right, significantly more likely to report experiences of domestic and family violence in combination with targeted abuse. So similar to the previous priority cohort, while they self-reported a higher rate and frequency of use of violence in the home, they were also significantly more likely to report childhood experiences of domestic and family violence and direct child maltreatment. Interestingly, for the remaining, the only other one is sexual orientation, but just interestingly, once we added that into a multi-regression analysis to see which one of these factors came up strongest or overrode any of the other predictors, disability was the strongest predictor. Once we entered disability into the mix of testing for the biggest impact on use of violence in the home, the other aspects of First Nation status, sexual identity and sexual orientation no longer came up as significant because disability was such a strong predictor of use of violence in the home. So sexual orientation, so heterosexual young people as opposed to young people identifying as another sexual orientation than heterosexual, were also more likely to use any violence in the home, report more severe use of violence and more frequent use of violence in the home. But equally, as you can see on the right, they were also significantly more likely to report experiences of childhood abuse. We asked young people how they made sense of their use of violence, and for many, primarily, it was linked to growing up with father's use of violence or male carers' use of violence in the home. Many of the young people said they knew what they grew up with. They never wanted to turn out that way. They never wanted to repeat those patterns, and yet they realized eventually they were using the same kind of patterns and mechanisms of behavior as the abusive parent previously had. I'm just mindful of the time. Carolyn, have I been at 20 minutes yet?
Probably about 20, but if you've got a bit more to say.
I do, but I'll get through it quickly and then I hand over to...
I can always speak quickly, Silke, don't worry.
That's okay. So, you know, as I said, father's use of violence in the home was one of the key themes that came out of the qualitative open-ended responses young people shared. In terms of the impacts, and I'm going to go through these quickly because they'll tie in nicely with what Kate then talks about, particularly around some of the settings that play key roles in young people's disclosure and support needs. Social and emotional impacts, you know, partly around their experiences of childhood trauma, for some of them also around their use of violence in the home, but young people spoke around the things that we commonly know from the literature already of young people growing up with childhood trauma in terms of poor self-esteem, depression, anxiety, social isolation, suicidal behavior. Physical impact, so in terms of the experiences of use of violence in the home, and again, probably not surprisingly, because some of the young people reported quite severe experiences of direct forms of abuse, and young people reporting the physical impacts, but then also the physical impacts the impact of physical injuries on social isolation. Again, probably not surprising. We know from the adult body of intimate partner violence literature, for example, that it's quite common for the victim survivor to be impacted by physical injuries beyond the immediate impact of physical injuries, because it has implications for participation in social engagement, attending the workplace or uni or whatever it might be, because victim survivors are aiming to hide those kind of impacts. Particularly in the non-English speaking background, identifying young people, we had quite a few things coming out around cultural impacts and disconnection, where young people tied their experiences of violence in the home, and they're replicating those kind of behaviors to their families, cultural ties, cultural identity, religious identity, which I guess was problematic insofar that we know that cultural identity is often a strong protective factor for young people where it is a positive cultural identity. But for the young people in this study, unfortunately, it was very often a negative factor that they wanted to distance themselves from because they connected their cultural identity or religious identity to their family's normalization of violence, use of violence in the home. Just quickly, school attendance and school engagement. We saw both heavily come out of the qualitative feedback that young people provided. School attendance, similarly again, because young people wanted to hide the impact of the violence that was happening in their home. They skipped school or they avoided school because they didn't want to be seen with some of the impacts of their childhood experiences of abuse. But then equally in terms of school performance, young people spoke about how their anxiety, how their unaddressed trauma, how their post-traumatic stress disorder interfered with their ability to participate in schooling. And I guess particularly around the impact that then had on school engagement, because the performance wasn't there. They struggled. While school might be a safe place for many of them because they were so overwhelmed, they couldn't focus in the classroom, or they would avoid being in the classroom because they had nervous breakdowns and spent time in the bathroom, but then equally had experiences of school labeling them as problematic or not engaging or not being present, as opposed to picking up on some of those red flags, I guess. And with that, I'll hand over to Kate to talk more about young people's disclosure experiences and support needs.
Thank you so much, Silke. And so, as Silke mentioned, I'm going to focus on the findings that were specific to our second report, which looked at who young people tell and what their experiences of disclosing were. And just to emphasize, predominantly the data that I present here is from the qualitative. I'll just go into is from the qualitative sections of our project. And we were very conscious that we were surveying children, young people, and not to overcomplicate our questions. And so certainly in respect to who young people tell, we asked very simple questions around who was the most helpful person that you told and who was the least helpful person that you told, in addition to asking them the breadth of people that they told. Just before I go into that, just adding to the acknowledgements that Silke has already done, I'm joining from Victoria, which is from the lands of the Wurundjeri people, and acknowledging elders past and present, and also want to extend that acknowledgement to any First Nations people who are joining the webinar today. So to start specifically with our findings around who young people tell, in our study, 1 in 3 of the young people that we surveyed who had used adolescent family violence had disclosed their use of family violence to a family member, being the most common. And then within that, they were most likely to tell their mother, with just over 1 in 5 disclosing their use of violence to their mother. In terms of beyond family members, who young people were most likely to tell about their use of family violence, just under 1 in 5, 18% of young people disclosed to a friend, and 7% of young people had disclosed their use of violence to a formal service provider. And we had some more details about who that might be in terms of whether that was to a counsellor, to a specialist practitioner, to a child protection officer, or in a very small amount of cases to police. So 2% of young people in our study, so 20 young people, had self-reported using family violence in the home and had been reported to the police for those behaviours. And we certainly looked upon it as a real positive that this number wasn't higher, given all the data that Silke has already presented on the overlapping and intergenerational impacts of violence on young people's own use of abuse within the home, we were pleased that this was largely being responded to outside of a punitive justice setting. Just to give a little bit more details on that small number who had been reported to the police for their use of violence, six were responded to a protection order, and this is a national study. Currently across Australia, there are different provisions in place as to whether a young person can be listed as the respondent on a protection order when it's against an adult family member within the same home, with some states permitting it and a couple not. And there was one young person who had been charged and prosecuted for an offence relating to their use of violence. The remainder of our findings are really focused on non-punitive system responses to adolescent family violence. So in response to the question, who was the most helpful person you told, you'll see I've just included a couple of the quotes from young people. And there were really a range of individuals that were identified by the children and young people that we surveyed as the most helpful person to whom they disclosed. But it was really clear through our content analysis that a number of young people identified their mother, their mum, as the most helpful person that they told about their use of domestic and family violence. Particularly amongst the young girls in our study, they really cited that their mum was understanding, that she was sympathetic, and critically that she took action, and that this was why they saw their mum as the most helpful person. So, for example, people said, you know, my mum, because she resolved the conflict peacefully. My mother was more useful as she went through the same as I did when I was a kid. So there was really that understanding there and that empathy. My mum told me that violence is bad and told me that controlling my anger towards my sibling is important, and that kind of helped. We also had that a number of young people also spoke about the way in which their mum had supported and helped them to understand and address the underlying reasons why they were using violence, and that had been incredibly helpful for them. There were a number of young people in the study that, and you can see here, that spoke about the fact that their mum too had experienced violence, and that was a key reason why they saw her as the most helpful, because they shared that experience. In terms of beyond the mother, a smaller number of young people cited their dad and their father as the most helpful person. It was really interesting in looking at the reasons why young people cited their dad. It was quite different to the reasons why young people cited their mum. It was more that their dad had the physical presence or the physicality to stop the violence and to intervene. So young people said things like, father, because he sorted out the argument. Probably dad, as my brother's physical aggression used to be targeted at him, now me, as I'm physically strong, so he understands fighting back. So it's very different reasoning for why dad was the most helpful person that they told. It wasn't also always dichotomous in terms of the selection of which parent was the most helpful. Some young people did list both their mum and dad as being the most helpful people that they disclosed to. So it didn't always have to be one or the other. 1 in 5 young people said that a friend was the most helpful person to whom they disclosed their use of violence. And young people were extremely appreciative and thankful for friends that showed understanding. And it really was that understanding that they wanted, and that sense that the friend had heard them and had believed them. So my friends understood that I acted the way I did because of how I was raised. And friends, they helped me realise that that was all I could do in my situation. So it was really that understanding that young people received from the friends that they told. Equally so, however, when we look at the least helpful people, we often found the same groups of people responded. So there's no kind of easy categories that people slot into here. In response to the question, who was the least helpful person that you told, we really noticed commonalities in why people were least helpful. And the key reason being when someone had disclosed their use of violence and had been met with inaction, that was cited as making them the least helpful person that had been disclosed to. So individuals, this included individuals who didn't believe the young person, who failed to take any action or suggest any possible actions, or individuals who ignored the disclosure or just excused the situation away. And young people really spoke here about the importance of validation and understanding when they do disclose an experience of violence. You can see here, mum would make excuses. Brother, as he didn't think anything was going on. Father, as he ignored the situation. Friends, they couldn't do much. There was some young people who reflected that disclosures were met with anger or retaliation, particularly from another family member. And then there was a small number of young people in the study who expressed a sense of guilt or regret for having disclosed their experience when it wasn't met with a helpful response. And particularly that came through in the sense of people who weren't met with action. In terms of when we asked people about service and support needs, we found that children and young people identified and suggested a number of support needs that they needed during their experience of domestic and family violence. And these findings really transverse across the experience of family violence and child abuse, as well as their experience of using violence. And it was tricky in the data for us to untangle whether the support need was because of their own experience of having experienced family violence directly, or whether the support need was for their use of family violence. But we found that the service and support needs really fell into 6 categories. Young people spoke about the importance of a safe space or a place, the importance of having someone to talk to, that trusted confidant, that person who would act, the need for professional support and the need for child-centred and age-appropriate professional supports, that education was needed for parents and young people about abusive behaviours, and also for young people themselves to understand that what they're experiencing is not normal. We also, I'll go into that in a bit more about the education. Supportive school environment was viewed as critical. And of course, these are children, young people between the ages of 16 and 20, many of whom would be spending a significant portion of every day at school. And then a supportive and understanding mother came through as a critical support need identified. And I'll just go into a couple of these in a few more details before ensuring we have time for questions. In terms of a safe place to go, this was the most commonly listed type of support that young people in the study said that they would have found helpful. And it was really linked to their desire to be able to seek respite, to have a break, potentially just a temporary one, but a break from their feeling of insecurity and violence. In some cases, it was also the desire to leave home permanently and to find a safe alternative housing or carer arrangement. So this really captured both temporary and permanent safe place mechanisms. We had a small number of young people in the study who talked about the importance of being able to remove themselves from the family home during the COVID lockdowns. And I think the timing of this data collection is really critical to understand in terms of support needs, because we were collecting data during times when, particularly for our Victorian sample of children and young people, but for all children and young people nationally, there had already been the national period of lockdown and periods of school closure. And I think in particular, we saw that that came through in terms of, for a small number of respondents, feeling that there was nowhere to seek respite or to avoid conflict that may otherwise have escalated, or that they may otherwise have been able to escape from if it wasn't during the COVID lockdown period. In terms, just saying COVID and I cough, that's terrible timing. In terms of why people wanted a safe space, it was commonly linked to the need for social connection within and beyond the family, and the need for safe connections with other people. This wasn't always about having a safe place just for them to go. It was a safe place to be with other people safely. Some of the comments that young people said was somewhere to go to escape it, a support system and a safe place in case of a serious event, having more and easier contact with other family members, having a place to go when things got bad. Someone to talk to, it's obviously quite self-explanatory, but this was the second most common support that young people identified that would have been helpful to them. And they really spoke about this in terms of the emotional support that it offers. what was really critical and obvious from the qualitative comments that were provided for this question was that having someone to talk to was important, but the active listening that person has to do for this to be effective support was absolutely critical. Young people talked about the importance of speaking to someone and then obtaining information and validation from that person. So it really needed to be followed by that action and that support provision. Young people within this study also had really clear expectations around accountability of the trusted adults that they reach out to in their lives. And there was really a clear expectation amongst young people that adults need to respond appropriately and consistently when young people disclose the use of violence. And there was a range of different experiences amongst the young people in our study as to whether that had been done. And young people expressed a lot of frustration and hurt and betrayal when their disclosures were ignored. And we can see the range in some of the comments here in terms of, I think, telling someone being there to tell me things that my parents never told me, a loving role model, and people who are understanding. People to talk to, an understanding of what our options were if we could leave culturally appropriate support. And one of the young women within our study said, I just wanted someone to give me a hug and tell me everything was going to be okay and that things would eventually get better. As Silke has already mentioned, school was a really critical component of this study for a range of different ways, both in terms of how the experiences of violence and use of violence impacted young people's engagement with school and attendance at school, but also in terms of what schools could offer as a key support location. And we've been teasing this out, hesitant in many ways, completely aware that currently nationally there is so much pressure on teachers, and so we loathe to add more to that and kind of present this with this caveat, and also the caveat that a lot of the children and young people in our study would have been doing some remote learning either during or in the period leading up to completing the survey. But education support needs were identified as critical for young people and for parents. And in terms of education in itself, some young people in the study really articulated the need for education for themselves and for their peers to understand what constitutes an abusive behaviour and to understand what is family violence, noting that quite often for them, they were growing up in households where violence was normalised, and particularly amongst their parents. So a need to have that education to understand that these behaviours aren't part of normal everyday, or should not be part of normal everyday behaviours. Other young people in the study also spoke about the need for greater education for parents and carers about the impacts of abusive behaviours on children and young people, but also to educate parents and carers in non-threatening parenting styles. And there was a small number of young people who spoke about that. And you can see from the quotes here from young people's voices how this theme of education manifested. We also, and as I've noted, a lot of young people spoke to the importance of supportive school environments and staff, and in particular the opportunities that schools have to identify young people's experiences of family violence and to provide support and to respond to their support needs. Some young people believed that having a more supportive school environment and a school that took a proactive approach to inquiring about individual student wellbeing would have been really useful for them, both in terms of providing a support, but also in terms of just putting them on a pathway to safety and to referrals for young people using family violence. Schools having a trusted on-site counsellor or psychologist available to students was seen as really important for a number of young people within this study. And there were some young people that spoke about the desire to have regular and individualised check-ins from teachers. And they really wanted that to be proactive, not dependent on them having to disclose first. And you can...
Oh, Kate, sorry. I was just going to jump in because we've had a couple of people just asking for clarification. when we're talking about disclosing, you're referring to a young person disclosing about their use of violence, but that might also be really kind of wrapped up in their experience of violence. Yeah,
absolutely. So here I'm focusing specifically on our subset of young people who had used family violence in the home, but certainly in terms of and had disclosed that use of family violence in the home. But we are conscious that there's significant overlaps here of the support needs, as they were also likely victim survivors in their own right in many cases. And I think you can't separate the support needs. So hopefully that clarifies. Thanks, Carolyn.
Yeah, thank you.
I'm conscious of time, and it'd be really great to have time for questions and discussions. But I think we did identify a number of policy and practice implications from this work, and it certainly reveals significant gaps in current responses to adolescents who use family violence in the home, and to that, significant overlap. We heard more from people as to what they wanted as opposed to the effective supports that they had received. We feel that there's really a critical need to develop whole of system suites of tailored, trauma-informed and domestic and family violence aware interventions for children and young people. And we know that's something that's been called for some time, but that really a significant portion of the reform agenda that's been underway for over a decade now in Australia has been predominantly focused on adults when we're thinking of victim survivors. So we feel that this study really contributes to further highlighting why children must be responded to as victim survivors in their own right, and even when they present to the system as using violence, that there is a need to understand that they are also likely victim survivors first and foremost. We also believe this study really helps support and communicate the key need to understand that supporting the recovery needs of young people who have both experienced and used family violence is an essential strategy if we're going to reduce the risk of intergenerational violence, if we're going to minimise the impacts of adolescent family violence on other family members, particularly mothers and siblings, and also to ensure that the trauma that's experienced by many young Australians as a result of family violence is addressed moving forward, and that the clear overlap here really demonstrates the importance of recovery needs for young people. That's our project website, where we do have links to the reports, as well as a fantastic shorter graphic representation of the report findings that Anne-Rose put together for us. And they're both Silke and my emails, and we'll be really delighted to follow up with anyone who has questions or thoughts that aren't addressed today. But extremely grateful to Carolyn and the Centre for the opportunity to discuss the study today, and looking forward to questions.
Thank you so much, Kate and Silke. I think, just the scope of this type of research is, is quite an undertaking, but so critical that we do get the voices of young people who can tell us directly about their experiences. I think one of the huge benefits of this type of research is that we can really show what practitioners have suspected and been saying anecdotally for such a long time, which is there is such a strong link between a young person's experience of trauma and abuse and violence and their own, their experience of violence and their use of violence. I think it really, hopefully, changes our conceptual understanding of the sort of profile of these young people. And I just mention that because I know there has been in the past, say, some stories that may talk about a young person's sense of entitlement being one of the main driving factors of their use of violence. But I think in hearing the young people's stories, I think that really sheds a lot of light for us. One of the questions that that has come in the Q&A chat is just regarding gender, because I know that also earlier reports and discussions have been have definitely mentioned gender as a contributing factor, but it seems like in reading the report that was not necessarily the case in this sample. Are you able to comment a little bit about gender?
Do you want me to comment?
Yeah, sure, Silke.
So there were some gendered findings, I guess, in terms of the self-reported use of violence, and there were some types of violence that were girls reported higher levels or greater frequency of use of types of violence, particularly in the emotional and verbal abuse space. There were no gender differences if you remember from the graphs I showed about the more severe end of violence in terms of, threats to harm, threats to kill, non-fatal strangulation, sexual abuse, and so forth. The girls were also much more likely to use violence against siblings as opposed to other family members. That's the only gender difference, really. And I think those are two things to keep in mind when the report looks at the, that I guess we didn't see the gendered dynamics that you necessarily see in adult perpetrated domestic and family violence, and that we had a fairly high rate among female participants reporting use of violence in the home. So I think it's important to keep in mind, that much of the violence reported in this home to start with was violence directed at siblings, and that girls were more likely to report use of violence against siblings than boys were. I think the other thing, and we haven't unpacked this any further yet. I think the other thing to keep in mind is that we know from some of the limited existing research on adult self-reported use of domestic and family violence, that there's some studies that suggest that women over-report and men under-report. As in, men are more likely, male perpetrators are more likely to minimize and under-report, whereas women are more likely to over-report use of aggression and abusive behaviours in intimate relationships. So I wonder to what extent there is a level of awareness, recognition, and then self-reporting and over-reporting among young girls in the study as opposed to young boys. Is that the kind of gender question we were after? Not the gender question in terms of the small proportion of, otherwise also happy to speak to that in terms of gender identity and, not in terms of use of violence, but I think there's other elements in there.
I think the question was just looking for a bit more of a breakdown in terms of gender and use of violence. So I think you've spoken to that. And the other thing that I do recall reading in the report was that perhaps, earlier reports have drawn quite heavily on police reports, and that possibly maybe parents, carers are more likely to phone police in instances of young males using violence, that maybe there is stigma or some hesitation to request police assistance if a young female is using violence. And I'm aware I'm being quite very binary in my talk there, but I think that's what statistics have used before in terms of young males, young females. I guess an interesting perspective.
Yeah, and I think similar to that also, I mean, I guess, the research is still so limited in this space, but one of the other things where we, have some preliminary data or impressions, I guess, is from intervention programs that specifically target young males using violence in the home. And in that dynamic, it seems to be primarily directed at mothers in families where there is adult level, or at least has been in the past, intimate partner violence, and we're seeing a replication of abusive behavioral patterns. But again, from those, I guess from those interventions, we're already looking at a selective bias sample, if you want, because it targets referrals for young boys who replicate abusive behaviours in the home, with mums being the primary target of their abusive behaviours in the home. So I think this is quite interesting because it is, as you say, very different to some of the other data sources that we usually rely on to get impressions of snippets of knowledge of what adolescent use of violence in the home looks like when service providers or crisis interventions, for example, become aware of it, as opposed to when you actually ask young people about their use of violence in the home, the frequency, the severity, and who's at the receiving end, and so forth.
Yeah, thank you. Another question in terms of the demographics and patterns and use of violence was whether you had any information about violence that was targeted at grandparents specifically. Did you look at any breakdown of the carer type?
We did, and now I'm trying to see which of us you'll see can kind of open the report quickest and get those.
Sorry, I'm putting you on the spot here.
No, that's absolutely fine. I think it really does. All of this really speaks to the amount that is in this report and is in the data. Silke, if you've been able to bring that up.
No, I've just opened the report, but I haven't.
Sorry.
I do know in the report we do have an overview of, and I'm gonna say grandparents were the least likely ones to be at the receiving end.
And just so we had 3% of the children, young people in our study who had used young people had committed that violence against a grandparent. So it was 31. We then also looked at uncles and aunts, which was the next least category, was only 1%. So predominantly it was towards a parent, including a step parent or a sibling, and then some of those other categories played out as well.
Mm-hmm.
And I think part of that is a reflection of who's a carer. So I suspect one of the reasons why aunts and uncles are the least likely to be at the receiving end is because they're also least likely to be in that kind of family setting where violence actually plays out, as opposed to grandparents who may either reside in a multi-generational home and or having taken on some carer responsibilities for the young people who participated in the study.
Mm-hmm.
One of the findings which we did have, and we were really fortunate to have Dr. Hayley Boxall working on a lot of the quantitative analysis of this study, but was that of that smaller group of young people who had used violence towards a grandparent, they were more likely to have used multiple forms of violence and for that to have been co-occurring over time. So 68% of young people who had been abusive towards a grandparent said that they'd have used both physical and non-physical forms of abuse.
Mm-hmm. Okay, thank you. Someone has just mentioned about specifically the use of image-based abuse and whether you had any sense of how that played out in this young people's use or experience of violence. Did you look specifically at that at all?
No, we didn't. And all I just say is that there is quite a few ANROS funded projects that are looking at technology facilitated abuse and image-based abuse. So if that's kind of specifically of interest and you haven't already, it'd be worth popping onto the ANROS website and having a look.
Yep. Okay, great. Thank you. Another question here, given the non-probability sample that was used, are you concerned that this problem is far larger than the findings might suggest? And is it possible to investigate what crossover there may be between experience of and or use of violence and disengagement from mainstream schooling?
Perhaps I'll
Bit of a
start
big
with
question.
Yeah, I think we're always concerned about underreporting whenever we look at family violence amongst any cohorts. The equally so though, when we saw the rates of self-reporting in this sample, you know, we were incredibly alarmed and just saddened by, I think, what we all know is a national crisis, but I think this study clearly shows the impact that it has on children and young people. I think just emphasising that the sample here, even though it isn't representative, this is not a sample of young people that we went searching for in terms of a study on domestic and family violence. So the high rates here, I think, are really significant. In terms of, we haven't looked specifically at the overlap and then how that falls out in terms of types of schooling. We weren't able to do that unless young people in their qualitative comments have specifically mentioned the type of school that they were attending.
Okay, thank you. Yeah, sorry, I don't mean to be putting you on the spot with some questions. I think people have some really interesting, you know, niche questions that they're quite interested to hear more about. A bit of a, I guess, possibly a policy kind of focused question there. The report really highlights the importance of early intervention to respond to young people using violence in the home. And I think you know, probably when we say early intervention, we could be talking about earlier in the young person's life, or we could be talking about earlier in their in those behaviours beginning in the first place. Regardless, the programs that we have responding to young people using in the violence, they often say that when they receive a referral, the young people and families are really operating in a perpetual cycle of crisis, and they don't initially, at least, have that capacity to do early intervention work. So what needs to happen for us to, or what needs to change in the system for us to be at a place where intervention can happen earlier? Is it about targeting different types of services, or, you know, doing these kind of assessments earlier on in another type of service? Any thoughts or?
Some, probably not a satisfying answer, I suspect. And I think some of it is so complicated because, I mean, I agree with what you just said, starting much earlier. Like, I think the fact that we have 9 and 10 young people who report using violence have childhood experiences of growing up with domestic and family violence and or child maltreatment suggests that we have opportunities long before these young people then come up with their problem behaviours for, you know, school disengagement, mental health issues, and use of violence in the home against other family members. I think one of the challenges here is, so I think this raises massive implications for early child-centered recovery for children to, you know, to maximize the opportunities for recovery and to break the intergenerational transmission of violence. I recognize the challenges for practitioners and service providers that very often when families or when services become aware of domestic and family violence in the home, there isn't necessarily immediately a space for recovery because, as you say, very often practitioners and service providers respond in crisis. Very often families may or may not be separated, and we know from the post-separation abuse research space that just because the victim parent is able to separate and to create some, I guess, some disruption to the constant experiences, children's experiences of use of violence in the home, we know that post-separation abuse is so common, and where post-separation abuse is ongoing, children don't have a space for recovery. And if you've got a perpetrator who's highly manipulative, that perpetrator will strategically make sure that children and young people have no access to recovery support, to counseling, psychological interventions, and so forth. So, you know, like, I think there's as much as the findings raise major implications for opportunities for early interventions, identification, and children's unique recovery needs that go beyond working with parents and disrupting the immediate experiences of violence. I also recognize that that varies from family to family in terms of the opportunities you have as a practitioner to work with a child on identifying child-centered support needs and recovery needs, because very often that young person at the time you see them in a practice space may not be in a space where recovery is actually possible. And I wonder to what extent that then raises implications for keeping young people visible, you know, and making sure children and young people don't drop off the radar once the crisis intervention has finished and once we've responded to the parent or carer level of immediate risk of harm, to make sure that when there is space for recovery, young people, you know, have an opportunity and access to recovery support. And I think if you look at the round this was funded a number of different projects on young people's experiences of domestic and family violence. And there's a big WA-based study in that ANROLS, on the ANROLS report is out, that looked at linking police data with mental health data for children that were known and recorded in police records as having experienced domestic and family violence between parents or carers. And I think they linked over 16,000 young people's records. 78% came to the attention of mental health services eventually, but on average with a 7-year service gap. So, you know, like there's a massive gap by the time we then pick young people up again for their, you know, very often for either their problem behaviors because they're labeled or stigmatized, or for their, you know, by then manifested mental health problems that come with a whole lot of other issues, including use of violence in the home, including school disengagement and so forth. So I think that, and our study really highlights that there is, you know, I guess the need for early intervention, but also the need to keep children and young people with childhood experiences of family violence visible to ensure they don't have that massive service gap, because the research suggests that the majority will eventually come back with mental health support needs.
Yeah, thank you. I'm reminded of I think Elena Campbell saying, you know, intervening in young people's use of violence comes about 10 years too late. It really needs to start much earlier on. But yeah, no simple answers to that one.
I think definitely, Carolyn. And when we asked people if they could remember the first age at which they were using violence, you know, for a large portion it was under 10 years old. Yet so many of our systems and structures are to look at adolescents and not children. And I think also just in terms of that early interventions, in many cases what young people were saying would have been most helpful for them aren't significant or complex responses. They want people to believe them and to validate what they've experienced. And I think, you know, that's really about education and training across all different community systems and services that have interactions with children and young people, so that that first response can be a validating and a supportive one. That was really what so many children and young people indicated was kind of most needed and most important to them.
Thank you. And that kind of segues actually into one of the next questions, which I guess, you know, in the report, you have really highlighted that there's a lack of trust in adult figures by young people who are really wanting that informal support. Although I know you did mention there were a number of young people who did mention family members or friends, for example, who were helpful. But I think ultimately there is that underlying disbelief or simply inaction when a young person is trying to speak out and ask for help. So I guess just after your comments or thoughts about practically, what can practitioners do to, just to try and to help build that relationship and that trust with the young person? Was there anything that young people said about, how they would have liked to have been asked or kind of led into that conversation? And someone has said, how can we help young people have hope and motivation for change?
I'm sure Silke will have things. I'll quickly jump in. I think the active listening was a really important thing for children and young people, that they needed to feel that the practitioner, the support person, the trusted adult was actually listening to them. And I think this is about making sure that practitioners are trained in how to respond to children and how to actively listen to children and young people in age-appropriate ways. This is different to responding to adults and their experiences of family violence, and their support needs are so different to the support needs of an adult intimate partner violence victim survivors, yet so much of our system is set up to respond to adult intimate partner violence victims, understandably because of the high prevalence there, but we do see this gap. So it's also really important that services and practitioners are resourced to spend the time and to engage in active listening with children and young people. I think all too often, if say a mother and 2 or 3 children come to the attention of a practitioner, that practitioner is time resourced for one client, and that's the mother. And no one has the children as victim survivors in their own right in view, and tailored child-centred, age-appropriate supports and engagement with them. So I think we really do need to build up a whole specialist system for children and young people.
Yeah, as Silke was saying, to keep children front and centre.
Absolutely.
Yeah. And I think just from some of the themes that came out of the open-ended feedback, the opportunities that start before we're talking about practitioners in a sense of the service sector that is, designated to domestic and family violence service delivery and or child and family welfare delivery, but the amount of young people that spoke about talking to a trusted person in their educational setting. And people really recognizing, accepting and validating, and where young people said, they wanted support, but they wanted their own support. They didn't necessarily want support that was coupled to conversations with their parents. And I think then young people lost trust because they said, I disclosed I wanted support, but then the school linked in my parents, and then I had to have conversations, or I got a referral to a psychologist with together with a parent at least, which, as Kate said, doesn't recognize the unique recovery needs of children as victims in their own right. So I think there's, broader implications for what adults can do in the conversation. I think the other thing that came out for what young people said, particularly when they disclosed in a schooling context, is that they really just wanted somebody who genuinely asked them how they are and what was going on for them. And, on a one-on-one setting, rather than just being asked in the full classroom, how is everyone this morning? So, I think opportunities, and again, going back to some of those young people that spoke about being so overwhelmed in the schooling setting, but nobody actually picking up on their displayed behavior as a sign to have a one-on-one conversation to dig deeper of how that young person is feeling and what kind of support needs that young person has.
Thank you. Yeah, so I think, I think a couple of our practitioners have spoken before about that need to create that space for the conversation initially, but then to not skirt around the issue. There does need to be some quite, explicit questioning around, how are you, what's going on at home, instead of just a generic, how's it going? And I think, yes, active listening, showing genuine care, they sound very obvious, but I think we do sometimes lose sight of those things in a system point of view. We've got time just for maybe one more question, and it's not a small question. I wanted to turn the attention to what someone has described as possibly an overrepresentation of young people with disability. So I've got a couple of questions there asking about, was there any analysis of different kinds of disability? Were you able to kind of look into that breakdown? And I guess that comes off the back of, you know, in our community of practice, we have a lot of practitioners talking about you know, really kind of specific needs for support around working with autistic young people and also young people with ADHD. So just wondering if you had any, further insights or data around that.
Yeah, so I think this is, I think, an example of one aspect of the study where we've begun the analysis, but there's still so much more that we could do, and it'd be really great to hear from practitioners in terms of what would be helpful in terms of informing practice. We asked all survey respondents to identify at the time of completing the survey what disabilities they were living with, and that was broken down in terms of whether it was a physical impairment, a visual impairment, an intellectual disability, a specific learning disability, and so that included a range such as dyslexia. We identified autism spectrum disorder, attention deficit hyperactivity disorder, and acquired brain injury, poor mental health that affected day-to-day functioning, or any other disability, and they could specify. You'd have a number in that who specified trauma as the disability that they were living with. And in terms of what we've done so far, we've grouped disabilities in terms of co-occurrence of disabilities or presence of disabilities, as opposed to looking specifically at how prevalence, experiences or support needs differ by the different categories of disability. But it is, you know, it's a really significant sample of young people who did identify as having a disability, and we can then go in and look specifically at different types of disability. But that's not something, unfortunately, that we've had a chance to do as yet.
Yeah, thank you. And I think certainly the People report highlighted as well that there was a significant amount of young people who were using violence who were living with disability, and I think those particular conditions that I had mentioned before were of greatest concern. I think in terms of practice implications of how professionals can best support these young people, I think that it kind of remains to be seen. And I think behind the scenes, we are trying to work on building up some resources and some sort of helpful guides around how professionals might go about that. And I'm just thinking, it's actually a huge question, and I think it's something which warrants its own specific discussion, which we'll try to look at doing at a later stage.
Just to say as well, our colleague on this project, Professor Jane Marie Marr, that's a specific interest and kind of passion of hers. She's done a lot of work looking at women with disabilities, experiences of family violence. So we are certainly hoping to delve into that a bit more. Just quickly, because I did take a peek in the Q&A and saw we did ask where young people, what their living arrangements were at the time of completing the survey. And we had 10 young people who were living in out-of-home care at the time. So a very small sample of out-of-home care.
Okay. Yeah, I think there was someone who had asked specifically about a residential care setting as well. And so whether that would have been identified in the sample, I'm not sure, or whether out-of-home care meant, a foster care, kinship care sort of arrangement.
Yes, in terms of living arrangements, we asked around, computer doing that. We asked, sorry, I'm just, Oh no, it's not going to find it nearly as quickly for me. No, I won't try and find it now, but we can break that up as to where they were living at the time.
Yeah, great. And I think that's something that we've typically not, the residential care setting, we haven't kind of delved too much into, not because it's not relevant or that it's not on topic, but I think it throws up other issues in terms of, I guess, occupational violence, or that's typically how it's been referred to. But I think, this person's question is certainly very relevant. I think it, warrants a bit more, again, another type of discussion. So many discussions coming from these questions. I think we might, I'm just having a look for any, there's a couple of quick questions. There was one that I did actually just want to get your thoughts on, and that is that we heard from the young people's comments that often the young person's mother is seen as a likely source of support and safety. So how do we then reconcile that with what we hear about mothers and female caregivers often being the target of the violence? Do you have any thoughts from either from this research or from previous research that you've looked at?
So I think one thing that we haven't done yet, and as Kate said, there's been so much data in that survey that, watch this space, there'll be more to come. One of the analyses that we haven't broken down is whether the young people who qualitatively said mum was the most useful person or the most helpful person or the most supportive person also predominantly directed their use of abusive behaviours against mum. We know overall that mums were the most common target of use of violence in the home, but whether the young people who qualitatively said mum was the biggest support necessarily also were the ones predominantly using violence against mum, we don't know statistically. I think the other thing, Kate and I, with another colleague, did a previous study and publication on mums' reflections on children's experiences of growing up with mums' experiences of intimate partner violence, and then young people as they get older starting to use violence in the home. And I think those mothers still were, I think because they recognized so strongly where that use of violence from young people was coming from, continued to support their young children or adolescent children. So I think, I don't find it surprising, even if we could link the data of the qualitative feedback that mum is supportive with the quantitative data of whether mum is the predominant target of that young person's abusive behaviours. I would not find it surprising if those young people still say mum was the most supportive, particularly where there is historical violence in the home, because mum will continue to be supportive and caring no matter what. Like, it just takes so much for mothers to step away and no longer be that protective, nurturing, caring parent, particularly where mum has also been at the receiving end of intimate partner violence and knows or recognizes where some of that adolescent use of violence in the home is coming from.
Thank you. I think I've been trying to pack in as many questions as I can, and I think I could honestly just talk all day. I'm not sure how many people would have the time or scope to listen into this discussion, but I think, as you've been saying, you've got so much data and really great insights from this research that you've done, and I think there's probably a few more reports you could pump out from the data that's been collected, not to give you any more work to do. But yeah, it's been really fantastic to have you here to give us that verbal rundown of the key findings. We will put links to the actual reports, as well as that the infographic sheet, which is really, I know, really useful as well for time poor practitioners. We'll put that link up on our website. I'd like to thank you so much for all of your time and effort for joining our discussion today, and a huge thank you as well to all the people who have tuned in. I will also mention as well that we do have a bit of a AVITH network for people who would like to subscribe to future events and discussions. So as I've mentioned, we've got a lot more discussion topics to cover. So please consider signing up if you'd like to stay in the loop. So thank you all, and have a very enjoyable rest of your week. Thank you.
Thank you very much.
Thank you so much, and thanks for the opportunity, Carolyn.
You're welcome.